Millions of people are now taking GLP-1 medications like Ozempic and Wegovy. But one question keeps coming up. Is it safe to stay on these drugs for years? Or are we heading toward long-term consequences we don't fully understand? Today, we're breaking down what the evidence actually shows about long-term GLP-1 safety, including risks, benefits, and what doctors are watching closely. By the end of this video, you'll understand what we know, what we don't, and who should be cautious. Medical disclaimer. This video is for educational purposes only and does not replace medical advice. How long have GLP-1 drugs existed? GLP-1 medications are not new. The first GLP-1 drug was approved in the mid-2000s for type 2 diabetes. That means we now have nearly 2 decades of clinical data in diabetic populations. However, widespread use for weight loss is more recent. This distinction matters because long-term safety data is strongest in diabetes treatment, not necessarily in younger, non-diabetic populations using it for obesity alone. The most common long-term side effects are gastrointestinal. These include nausea, vomiting, constipation, diarrhea. For most patients, these symptoms improve over time, but in some individuals, digestive slowing continues. Because GLP-1 slows gastric emptying, prolonged use may increase risk of chronic bloating. Persistent nausea. Rare cases of gastroparesis. Gastroparesis means delayed stomach emptying beyond normal physiological range. It's uncommon, but it's being studied closely. One major concern has been pancreatitis. Early reports raised questions about inflammation of the pancreas. However, large clinical trials have not consistently shown a major increase in pancreatitis risk. Still, individuals with a history of pancreatitis are typically monitored more carefully. The overall risk appears low, but not zero. And in medicine, low risk does not mean no risk. GLP-1 medications carry a boxed warning about a rare thyroid tumor seen in rodent studies, specifically medullary thyroid carcinoma. Important clarification. This risk has been observed in animals, not clearly confirmed in humans. But because of this signal, these medications are not recommended for individuals with personal or family history of medullary thyroid cancer and MEN2 syndrome. This is precautionary, but taken seriously. Another symptom is at the level of the gallbladder. Rapid weight loss itself increases the risk of gallstones. Since GLP-1 drugs often cause significant weight loss, gallbladder issues can occur. This is not necessarily caused by the drug directly, but by the metabolic shift. Symptoms include upper abdominal pain, nausea after fatty meals. Monitoring is important in rapid weight reduction phases. Here's the key question. Can someone stay on GLP-1 for many years? Current evidence suggests that for appropriate patients, especially those with diabetes or obesity-related complications, long-term use can be medically appropriate. In fact, obesity is a chronic condition, and chronic conditions often require long-term treatment. The bigger concern is not duration alone. It's whether the benefits continue to outweigh the risks. Who then should be cautious? Extra caution may be needed if someone has history of pancreatitis, severe gastrointestinal disorders, family history of medullary thyroid carcinoma, significant unexplained abdominal pain. GLP-1 therapy should always be individualized. Not everyone is an ideal candidate. Here are a few beneficial aspects GLP-1 drugs have shown. Reduce A1C levels, significant weight reduction, cardiovascular risk reduction in high-risk patients. Some studies suggest reduced heart attack and stroke risk in diabetic populations. That's not minor. When evaluating long-term safety, benefit must be weighed against risk, and in many higher-risk patients, the benefits are substantial. So, is GLP-1 safe for long-term use? For many patients, current evidence suggests yes, under medical supervision. But like any medication, it carries risks. Long-term safety isn't about fear. It's about informed decision-making. If you enjoyed this video, make sure to subscribe, like, and drop your comments down below. In the next video, we will explore how soon GLP GLP-1 medications start working upon commencing dosage. See you in the next video.